سيمينار بعنوان Middle Third Fracture submitted by منتظر جابر عبد العليم محمد عبد الكريم دياب Group D1. قسم الوجه 3 third من الهير لاين للجلابلة ومن الجلابلة للسب نيزالي ومن السب نيزالي للمنتون. ميد فيس من يتكون اناتوميك من الماكسيلا بلاتاين بون zygomatic bone zygomatic process of temporal bone nasal bone lacrimal bone vomal ethmoid bone concha inferior subordinate pterygoid bellate of the sphenoid of the maxilla zygomatic maxilla bone nasal bone orbital bone zygomatic bone maxillary bone nasal bone. Etiology RTA full from high occupationally accident writing support injury while injury. Physical characteristics of the mid-face skeleton. Middle third consists from multiple bones, can be rarely fractured in isolation. This type of structure able to withstand considerable force from below but early fracture other direction. Act 3 acts as the cushion for trauma directed to the cranium. Classification of mid-face fracture: dentoalveolar fracture, zygomatic complex fracture, orbital floor fracture, nasal complex fracture, maxillary fracture is only for 1, for 2, for 3. Clinical presentation: prevalence the zygomatic maxillary complex 40%، بينما اللي فورت 1 15%، اللي فورت 2 و 3 10%، and zygomatic arch 10%، and alveolar process of the maxilla 5%، other 5%. Dentoalveolar fracture can be damage to teeth, damage to lip. Alveolar fracture نشوف fracture to damage to tooth and alveolar fracture. Management of the injury to alveolar bone: block or plate fracture, finger manipulation, reduction, close and fixation, rigid wire and composite splint, elimination of the premature contact and occlusal trauma, short intermaxillary fixation. Fracture of the zygomatic complex. The classification of the zygomatic complex fracture of the body is minimal or no displacement, inward and downward displacement, inward and posterior displacement, outward displacement, and combination. The fracture of the zygomatic arch. 2. The fracture of the zygomatic arch, minimum or no displacement, V-type fracture, combinated. The sign and symptom: extraoral inspection, circumorbital ecchymosis, subconjunctival hemorrhage, edema, clotting zygoma region, limitation of the ocular movement, diplopia, strabism, enophthalmus, limitation of the mouth opening, unilateral epistaxia. Fracture of the zygomatic complex of the body. Palpation: tenderness over the cheekbone, tenderness and separation of the frontal zygomatic suture tips at inferior orbital rim, paresthesia of the cheek. This intraoral examination can be by inspection, ecchymosis at the buccal vestibule and the region of the zygomatic maxillary suture. Possibility of the occlusion gagging in the molar region. By palpation, tenderness, anesthesia at the upper lip. Zygoma arch fracture clinically finding palpable bone defect over the arch. Debris check with the tenderness, pain and the cheek and jaw movement, limited mandibular movement. Steps of surgical treatment, pre-surgical image, prophylactic antibiotic anesthesia, detailed clinical examination and force detection test, protection of the globe, antiseptic preparation, fracture reduction, assessment of the reduction, determination of the necessity of the fixation, application of the fixation device, internal reconstruction, assessment of the ocular mobility, reconstruction with the bone graft, soft tissue management, post-surgical ocular examination and post-surgical image. The complication malposition of the soft tissue on the bone, complication of the bone malposition, ocular complication, malposition of the soft tissue on the bone, closure of the periosteal incision, refixation of the tissue on the facial skeleton, complication of the bone malposition, maxillary sinusitis, inaccurate alignment, orbital rim, zygomatic arch, reconstructed flat rather than the curve to achieve satisfactory reduction.
Assalamu alaikum. My topic is about orbital floor fracture. My name is Muhammad Abdul Karim Diab. So first of all, we have this picture. I can show you the superior orbital fissure and frontal bone, optic canal, palatal bone, zygomatic bone, inferior orbital fissure, and laser wing of the siphonet. Also, this picture can show you the optical bone, extraocular muscles, optic nerve, orbital bone. About the classification, first we have the orbital wall fractures. There's four orbital wall fracture is about blowout fracture, pure blowout fracture, impure blowout fracture, blow-on fracture. So isolated orbital wall fracture is the first of all we have the roof, the second one is floor, the third one is medial wall, the fourth one is lateral wall. About the buckling عندما يحدث ضربة أو pushing in the sinus. This picture can show you. Also we have the signs and symptoms. First of all we have the edema, COA, CSC, emphysema, lateral epistaxis, paralysis within the disruption of the inferior orbital nerve, limitation of eye movement, enophthalmios, diplopia, ptosis, and proboptosis. About the investigation, the forces duction tests and cardinal position of the gas. The third one is the Hess chart. The force reduction test. This test used to differentiate between the muscle entrapment and muscle paralysis. This picture can show you about the difference between entrapment and muscle paralysis. Also about the radiographic, we have A and B, optically of the sinus. The second one is hanging drop sign. About surgical management, surgical treatment aims to the permanently close the bone defect, free interpelled tissue or muscle from the fracture, cosmetically assume a normally anatomically arrangement of the bone orbit and the orbital contents, expand area of the PCV, resolve diplopia. So NB surgical often management by the facial-maxillary team with the ophthalmology team, especially the lumbar blowout. This picture can show the nasal complex fracture also. عندما يحدث كسر في الساينس من الجهة العليا للأنف. About the sign and symptoms. So first of all we have the edema, CSH, COA, laceration تمزق بالأنف يصير, epistaxis نزيف, division of the noise, انحراف بالأنف, mobility of bone, before. About Lyford fracture. So Lyford fracture are the fracture of the midface which collectively involve the separation of all or operation from the midface from the skull base in order to be separated from the skull base. There is three types of the Lyford fracture, the class 1, class 2, class 3. About the first type of the Lyford fracture, it's horizontal maxillary fracture, separation in the teeth from the upper face. The second one is a pyramidal fracture with the teeth at the pyramid base, and nasofrontal structure is the apex. The third one is the craniofacial disinjection, transverse fracture in line base. through the nasofrontal stator. Maxillary front structure. Also, this picture can show you the class 1, class 2, class 3 from middle and from another side. This is the report first one, type 1. About the clinical finding: facial edema, malocclusion of the teeth, mutation of the maxillary wall, the nasal bridge remains stable. So about the cerebrospinal fluid, CSF lake. So it's the fluid that surrounding from the brain and the spinal cord. It conceals the brain and the spinal cord from injury and also severe as the insurance deliver and wasted removable system. For the brain, the manufacture continuously in the area of the brain, so called it's called ventricle, and absorbed by the blood stream. Also, this picture can show from where it comes the anterior performance substance. About the radiograph for maxillofacial trauma. This picture can show the trauma of the maxillofacial. We used to diagnose the fracture or trauma. Occipital mental view: left inferior nasal conches, frontal sinus, ethmoid sinus, nasal septum bony. About the zygomatic arch, mandible. Submental vertex view can show the zygomatic bone, zygomatic arch, temporal bone. About the management of the left front fractures. So, timing of the surgery, controversial issue, daily repair from 7 to 40 days, manipulation of bone and soft tissue, injury, supervision of the edema, risk of the fibrous and healing is there, unstable paints, hemodynamically unstable and the increased intracranial pressure ICP, immediate only in stable patient. Thank you, that's all.